So what we're going to look at next are some of the common diagnoses and problem that people have within the neck region. So the most common thing that we hear from our patients coming in and for those at home are headaches. And this can range from very dull aches and pains, it can be sharp stabbing, to migraine life-changing headaches. Headaches for people can change their entire life. For some people who suffer from headache issues consistently, they're having daily stress and tension headaches. They might be having migraines 2 or 3 days a week that cause them to miss work, or more importantly, to miss time with their family. Some people even have character-altering headaches and migraines that change their personality because they're in so much pain. Whiplash is a super common issue within the neck, and a lot of people think that they have to have been in an auto accident to have a whiplash, and that's not true. You can be walking down the street and someone can bump into you in an awkward way where your neck gets jarred left and right, or someone can run into you from the backside and you can have that neck jar forward. And a lot of our young athletes and our kiddos today are having all sorts of whiplash issues with the sports that they're playing. Hard knocks on the ground, certain sports like football or certain martial arts have a huge impact on facilitating whip-like injuries or whiplash-like injuries within people of every age. So being able to have a way to address these issues as they're happening is going to be very important. Another issue within the neck are disc and vertebral degeneration. This is a very common area to see the discs and the vertebrae wearing out at a very fast rate because of the amount of stress and tension that people are under that causes the connective tissues to contract at an exorbitantly high rate, causing all of those bones to kind of smash together, causing the discs in between to wear out and eventually bulge and herniate. So disc and vertebral degeneration is a very common problem within that cervical spine because these bones are much more thin and the discs are much more thin within the neck, but some of the musculature for the neck is just as big as some of the muscles in the arms or in the back. So they're under a tremendous amount of stress and pressure. And neck fusions and discectomies are some of the most common surgeries performed on the neck today. Thoracic outlet syndrome is another huge problem that you might not realize that you have, but because that neck is so bound and constricted, as the nerves leave the spinal column out of the neck that are supposed to go down into the arm and the hand, the neck musculature in this region can contract at such a high rate it actually impinges this nervous tissue or the vasculature as it's trying to feed the arm and the hand. Another common area that this can happen is where there's an impingement happening for your brachial plexus in between your clavicle and your first rib, all because that neck is being scrunched down by all of this very tight constrictive fascial and musculature. Another element that could lead to thoracic outlet syndrome is just the positioning of the head and the neck. As we see more and more people on their computers, driving long hours to commute to work, driving their kiddos around from practice and swim lessons and all these different things, the position of the head and the neck really can constrict the nerves, the veins, and the arteries that are supposed to feed the arms and the hands. Next is jaw and ear pain. What's really interesting within this region of the body is that some of this musculature that supports and positions the head and the neck actually directly connects into certain aspects on the skull and on the jaw. So you might not have neck pain specifically, but maybe you're having ear or jaw pain. You could be having ringing in your ear, you could be having issues with chewing, not necessarily because there's something wrong with that tissue, but because the position of the head and the neck are just not quite in the correct spot. So it's really important that we have an ability to be able to address the tension within the jaw and the neck and the head, and we've created something that's really simple and effective to be able to put into play for those issues. Some neck pain statistics. This is really fascinating. In 2011, there were 36,000 cervical neck injuries. Almost 40,000 people had some kind of a trauma to the cervical spine. Neck pain is the third leading cause of reported pain following back pain and headaches. So we can see that neck pain is such a huge epidemic throughout our culture, and being able to have a way to address neck pain as it's happening is something that's profoundly important. Something that we need to keep in mind is that the more we learn about the connective tissues and the brain and pain science, the more we learn about how our thoughts have an impact on the pain that we're experiencing. There's been some very interesting studies and research that's been done, and what we've learned is that when people are experiencing a trauma to their body, if they're in a negative environment or a positive environment, it actually changes the amount of chronic pain that they could have moving forward. So we have seen research where people have been in demolition derbies, and what they estimated is that a demolition derby driver has a 15-year lifespan or a 10-year lifespan where they go through their career. And so the career of the demolition derby driver is over a 10-year lifespan, and they have an estimated 1,500 collisions where they're experiencing a whip-like event, a whiplash-like event. Now, a person can have a single motor vehicle accident where there's one collision, and what they found is that only 10% of the time our demolition derby drivers experience chronic pain, and 30% of the time after one collision where a person had a whip-like lash event, they're experiencing chronic pain. Another piece to this is that there's a research study that was done that shows that children that play contact sports growing up have 30% less pain or chronic pain issues than kids who don't play contact sports growing up. So the conclusion to these research studies show that the environment that you're in and the mental state that you're in when a particular trauma happens can have a lifelong lasting effect on whether and how your brain is going to experience chronic pain. So these are important keys that we need to keep in mind when we're looking at the pain experiences that we're having. The next piece to this that we really need to understand is that the past biomedical or structural model where we're told that if you have a herniated or bulging disc, you're going to have this level of pain. And what is being shown right now in the pain science research world is that there is no correlation to the level of pain that you have and the amount of trauma that you have in your neck. And the other thing that happens from this is that when a person is so focused, or a therapist or a medical provider only looks at a single spot, we're seeing all of these people having all of these surgeries, they're getting all of these medications and injections, and they're still having the same chronic pain issues. So what we have to take into consideration is the whole structural model of this whole neck, the whole shoulder girdle, and really look at and understand that just because a person has a particular lesion within a tissue or one of the bones is having a hard time, that doesn't necessarily mean that they're actually going to be having severe pain, and the opposite of that is true as well. If a person does have severe pain or severe injury within their tissue, they might not report pain whatsoever. And in fact, we're seeing a tremendous amount of studies where people are having a significant amount of herniated and bulging discs, and they're totally asymptomatic, which means they're not reporting any pain issues whatsoever. So we always need to take into consideration a person's unique experience on how they tend to process information and how their nervous system is connecting with their body. And as we look at how the body is connected, the neck is a really interesting situation because there are so many very large, bulky muscles that connect to all of these small muscles within the neck and the head, and they put a tremendous amount of pressure within this region. And so as these muscles come from way low down on the spine and they travel all the way up along the spine from the low back up into the neck, or from the shoulders up into the neck, we even have some musculature that comes off of a bone in our throat that comes down and attaches into the shoulder. So we need to look at this whole structural unit when we're trying to help people create more balance and functionality within their neck and head region. The next piece that we need to keep in mind is that the fascial system, or the word fascia, is the new buzzword right now. And people are saying if you could just get your fascia to open up, that's going to fix all of your woes. And the truth is that we can't ever just focus on one particular kind of tissue. Whenever we're working with the body, or you're moving, you're doing any kind of range of motion, you're always engaging all of the tissues at the same time. So this fascial webbing that does have a very important job of organizing the muscles and the veins and the arteries within the neck can get out of balance. It can become sticky. It can become glued together. That doesn't mean that that's the only thing that's going on. And we need to look at the relationship of how the whole neck unit is working together as a whole, or maybe how it's not working together very well.